beyond the school, there are other programs out there that are designed to reduce substance use in the community. So they focus either on the community or on the family, and we're going to talk about them, or both types of programs, very briefly. So family-based interventions, these have typically been developed using things like social learning theory and social development theories to understand how the adults, the caregivers, can influence the behaviors of the children. They tend to stress the risk factors. So what's causing your substance use, both to the individual at all ages, and then what's actually protecting them, and how can you decrease the number of risk factors in the family and increase the number of protective factors in the family. Now, these can be effective. Family programs do work, but they are highly intensive. So I have the Strengthening Families program up there. It was developed decades ago. It's still in use. There are multiple iterations of it now, so they kind of update it to make sure that it's still kind of using the best available science, but it is intensive. The different iterations range from 7 to 16 family sessions. Now, at this point, even growing up, we may have sat down to have, family dinners together, but to have that type of commitment, it takes everybody involved being willing to do the work. So it's not something that can just be done passively. Every family member needs to be actively involved and actively engaged to see a benefit. And even then, the research coming out of programs like this and others have shown the most effectiveness for marijuana use. So some of the more prevalent things like alcohol use and tobacco use, or some of the more relatively dangerous things like cocaine or opioids, the research isn't quite there that family-based interventions are effective at reducing their use. And let's briefly touch upon community-based interventions. So here we're talking about bringing multiple organizations and multiple people in the community to come together, create a program to reduce the prevalence of substance use in an area. It's a very public health thing to do a community-wide program. Unfortunately, the downside is that the studies of them don't really show much of an effect. If there's a statistical effect, it's very small, so there's kind of some debate whether it's practically significant. These programs focus on community organizing and the idea that the community members themselves are participating in the intervention. This is more than just putting up flyers and hope people see them at the bus stop. This is really having people in the community most impacted by substance use being a part of the solution and helping actually generate the interventions at times. So this is really part of community-based participatory research. There's often multiple components to these programs focusing on both the environment as well as individual behavior change. And that may actually be part of the reasons why little effects have been seen in the studies that are done. When you have community-based programs and when you have multiple components and you have something that's really close to community-based participatory research, it's really hard to analyze the data, and when you do analyze the data, figuring out where the effects are. So if a change in a neighborhood in the prevalence of substance use occurs, is that due to the intervention? Is that due to the program? Are there other environmental causes? Is just kind of market dictating that prices go up or down, whether that's legal or illegal drugs? So trying to tease apart what is the actual intervention here can be very difficult. And something to keep in mind, it shouldn't restrict you from developing a community-based intervention, but you do need to keep in mind what it will take to actually figure out to determine really on a causal level that the program worked as intended.